Hello and welcome back to the Digital Health and Wearables series. Today I have another magnificent episode and leader for you. But before I go ahead, let me remind you to subscribe to the magnificent content of the channel and also acknowledge our digital health platform Clinitouch V and our series partner Fujifilm. And today we have a magnificent leader. We have Zahid Ali. He's a digital health and innovation leader, also a HIMSS 2022 change maker and founder at TECHMEDO. Zaid, how are you?
So I'm good and pleasure to be with you on this amazing platform. So it's an honor to just speak with you and convey some of the messages to a greater audience. Thank you.
Brilliant. Zaid, thank you so much for being in here, accepting my invite. Also, I've been following your great work. We go into that towards the middle and the end of the interview. But today, the topic, if you like, is building a real world integrated care delivery model at national level, our discussion. And the first question that I have for you is how a low income country can build a rapid response?
Yeah. So uh, with this, a lot of challenges that different economies and countries face, even in emerging world, they were having different challenges. But the people who are living below poverty line and the countries who are into low and middle income countries, so their healthcare systems were already stranded, and the problem that they were facing. So how to come up with something that can convert their standard system into an efficient system. So this is something that is a pretty interesting idea, and this is something that we have done in Pakistan, and that resulted into like huge benefits for the people who are poor and who cannot afford quality of care, and even in these pandemic scenarios where patients cannot connect directly face-to-face interaction with the doctors. So this really had a huge value, and and with this obviously we have achieved great results by implementing some of the methodologies into three different stages. The first stage was to build a response that is very immediate, and obviously in second stage what we did, we have like we have an integration engine where we integrated different tools and technologies. Then state become a driver of these initiatives, so that people have trust, and the real efficiency was built by connecting all the capacities that are available in the country out of the country, make them available under one platform, and then make it available through a single point of entry to the large populations.
Brilliant.
So that is something that is an amazing model that we adopted. And on the same model, I would be speaking at HIMSS 22 in an educational session where I would be just giving all the insights about how this model really worked, and what are the prerequisites, how this model was set up, and how an immediate response was built to just go very fast, because there was no time to do a rapid planning to cover the challenge that was faced globally everywhere in the world.
Brilliant, Zaid. And we're talking about IMSS 2022 before the recording.
Yeah.
Thank you for
So
that amazing insight. Moving on to the second question is how this mode provides affordable, accessible, and equitable care to the large population.
Uh, when we talk about affordability, accessibility, and equitability, so obviously we are touching universal health coverage. So, and that is something that WHO has set in for the world to achieve universal healthcare coverage by 2030. With the model of care that is integrated, that is inclusive, and that really converge the capacities that are available in different segments, the capacity available in the private sector, the capacity is available in the public sector, and the capacity is available with the different global NGOs, or the organizations that are working to provide healthcare services to the deserving people. So when we connect all these different elements, then it becomes very easy to provide an affordable, accessible, and equitable healthcare to large population. The importance of this model is we can just go by providing the services to the people who cannot afford at a free of cost, because when in any places of the world, when there is a problem where large response is required, so people just come forward. Even the doctor community, I really salute to the doctor community who took the burden, and they came forward, and they took it as a mission, and they are willing to go extra mile. The need really becomes how to just connect all these different doctors, paramedics, facilities, and even that technologies are basically a vehicle to provide these services. So if there is right technology that can reach to a people, to the mass populations, and obviously mobile and web is really very helpful. So the people, in order to build an inclusive model, the most important thing is there would be people who are living below the poverty line, and they are not having the smartphones. So what is the best model for them to just provide care? So in this model, we also try to make it inclusive in a way. The people who are having a normal feature phone, maybe the phone which had a couple of numbers, so they can also access to these digital platforms in the same way a person is connecting from the smartphone, and they can have same level of care by connecting through SMS, chatbots, or even a normal a landline call.
Fantastic, Zay. Thank you so much for that amazing insight. You shared the World Health Organization vision to create a more accessible system to all by 2020-30, which is very ambitious, but certainly possible if we work together. I'm certainly very committed to push this industry forward. I remember I was working with a brand a few years ago, and they had this hashtag health for all. I've been working with a lot of different brands, and what you also mentioned about the accessibility, for example, with the mobile, not everybody has access to the latest phone or to the latest connectivity, or so there are many challenges on the ground in real terms. Thank you so much for highlighting that. And the third and last question that I have for you is, what are the different engagement strategies that are used to build an integrated care delivery?
Uh, like building an integrated care delivery, the first strategy is always identifying different stakeholders that are involved into care delivery. And second step is how to build a common framework through which all these different providers or care delivery partners can connect, and they are accessible to the large populations through the web, through the mobile, or even through like feature phone, or maybe even they can access these care services through some of the pharmacies that are available in nearby areas, or some of caregivers or care providers that are available into their areas, but those are not pretty much doctors, but they can just take the vitals, guide to the patients what doctor has told. This is a second part of strategy. And then third part of engagement strategy is connecting all different facilities, labs, radiology, different maybe diagnostic centers and the hospitals, and then taking it forward by integrating all into one platform that is getting the data from different sources, making sense out of data, and then that data can be used by for the decision making. You see, there is a very simple workflow in this engagement strategy. Like if a lab is X lab is doing a lab a test, and a patient is either hepatitis positive or maybe a COVID positive. So then there is automatically a pathway that has to be followed. Either it has to be hepatitis pathway or it has to be COVID pathway. So rather than waiting for the patient to take an action, go to doctor or maybe make appointment, the system should act by itself. System should give a message to the patient, and automatically should tell the patient that these are the doctors available. You can immediately connect, talk to the doctor, and get his opinion. And then if doctor is prescribing a medicines, or maybe some investigation, so those things can be availed maybe at cost, or maybe provided by the government or by the insurance coverage. uh, and they can go collect the samples from the patient, and the results are uploaded onto a platform, and those results are available to the doctor and the patient as well. So these are a couple of engagement strategies. And the one important thing that I think world must do and must learn from the experiences that we had applied is there is always a big space in healthcare for the innovations. So in order to build those innovation, then another engagement strategy is to build academia researchers together and under into one umbrella. Give them the challenges, let them solve, build the solutions for those challenges, make them compete again for the challenges, and then take the best technology solutions available to large population. So this is a kind of a health innovation initiative that is, I guess, very important for the healthcare industry at large. And I feel every hospital has to build something, or even providers has to build something where an innovation culture is there, and so that they can find rapid solutions. And innovation should happen where the problem is happening. Innovation should not happen into only labs, or maybe some of technology centers, or by the big tech companies. All those players has to be part of these innovations. But obviously I feel that innovation should come where the problem is happening, and the people who see those problems, they can find the best solution. And then these big tech companies, or maybe some of pharmaceutical drug companies, they can help to scale those innovations into a large commercial model. So that was another engagement strategy that can be applied, and that had immense potential, and that can create an immense value for the overall healthcare system in any part of the world.
Brilliant.
Thank you.
Zay, thank you so much. You said so much in there, the communication between, of course, the doctors, the patients, but also you started with a very important strategy. And the first item was to identify all the stakeholders involved and, of course, involve them. Yeah. Very important, because now, as you know, we're seeing the patients and the associations and academia, everything, everybody's coming together. But it was not always like that. I think only now we're starting to get the grasp. But you mentioned so much. You mentioned the innovation. You mentioned like the innovation should happen at source where the problem lies. Thank you so much. That was incredible. A lot of good strategies for our audience. And Zaid, we come to the end of the episode. I'm not sure if you know this, but I finish all my episodes in a peculiar way. It's not a question as such. It's called 1 minute of fame. And certainly I have something in mind for you, but I'll let you talk about anything personally on your personal life or awards, anything that you wish. Over to you to round up 1 minute of fame. So,
Yeah. As I had been working in different parts of the world and had seen worked with the very established world like institutes like Harvard, Stanford, California State University, and some of the big startup funding mechanisms. So I feel that the world should see things from a different lens right now after this COVID, and world should just really move forward in a way that there is a model where the systems and the people are talking to each other, and they are talking to solve the problems collectively. And the problem is not something that is a problem with one country or one state. No, the problems that we are facing right now or we would be facing in the future would be something on a very large canvas. In order to solve the problems with the large canvas, so everybody needs to roll up their sleeves and should really work for the humanity to solve these problems. And this is my thinking, and this is my words, and this is I would always advise young people who are coming into digital health field. They need to see things from this lens, and they should come forward to solve these problems by putting themselves in deep into these things, and come up with different models that are not solving the problems in one specific area, but these should solve the problems globally. And and the other most important thing that I feel, now we need to collaborate to accelerate these adoptions. Thank you.
brilliant. Zaid, what a way to finish. Thank you so much. Also, congratulations on your work globally and on your HIMSS Health 2022 Digital Health Award. Congratulations on that, Zaid.
Yeah, and thanks, João, for inviting me over here. And it's an excellent initiative that you are leading. And obviously, the people are coming. They are talking about the problem. They are sharing their experiences, and this is one part of the strategy that I was speaking. And this really there is complementing that strategy, like sharing the knowledge, sharing the collaboration, sharing the work or experiences with the global community. And I really appreciate and commend the work that you are doing. Thank
Brilliant,
you.
Zaid. Thank you so much for being in here. I'm gonna round up now. Um, Make sure you follow Zaid's work. I'm gonna post his LinkedIn and his Twitter. Connect with him. Follow his amazing work. And before we go off air, make sure you subscribe to the channel. And also let me acknowledge our digital health platform, Touch V, and our series partner, Fujifilm Healthcare. And I'll see you all next week.